Today I would like to talk about wrong-sided nerve block, or when your clinician perform wrong-sided block on you when you go for a surgery. Wrong-sided blocks are a significant, though a rare, perioperative morbidity. Wrong-sided blocks constitute the most common type of perioperative wrong side procedure reported to health authorities in various parts of the world. Today I would like to talk on the patient consequences, factors that contribute to wrong-sided block, local procedures to prevent it and also to report it, as well as to learn from it. And also I would like to brief the public, the patient, what consequences they face because of wrong-sided block performed on them. Analysis of 4 publications reporting on at least 10,000 nerve blocks worldwide provide rates of 0.52 to 5.07 wrong-sided block for 10,000 blocks. So it's very rare. Commonly mentioned potential consequence was a local anesthetic toxicity. The local anesthetics were given according to the body weight of a particular patient. If you exceed, that can get absorbed and potentially it can cause harm, but it's very rare. And also complications from unnecessary block, such as nerve injury. Hospital discharge can be delayed because of dexterity or mobility problems. At worst, a wrong side nerve block can lead to the surgeon performing an operation on the wrong side of the body. The most commonly mentioned contributing factors: time pressure, personal factors, lack of side mark or including no side mark, and also it was reported that distractions in anesthetic room, social activity in anesthetic room, long waiting between WHO checklist and the performing of the block, and also human error. How to prevent wrong-sided block? The WHO sign in the patient identity, consent and marking of correct side are confirmed, then just before you perform the block, stop. Immediately before needle insertion, the correct side confirmed by the anesthetist or the assistant, visualizing the surgical marking, asking the patient if he's awake, what side you're operating, and also double checking with the consent form for the site. Time to be vigilant. Long duration of primary anesthetic. Prolonged time since the WHO checklist after turning the patient. Busy anesthetic room. Excess distraction. Lower limb blocks. Surgical site, the arrow may not be seen. What to do when you realize the wrong side block? If you have realized before the surgery, if it's appropriate, you can do the block on the right side. At least patient will be pain-free. How to report it? Inform the operating surgeon and the theatre team immediately. Inform the anesthetic lead, floor coordinator or the on-call consultant according to the local policy. Critical incident form to be completed. Inform the patient when it's appropriate. If the patient is awake, you can inform them ASAP. If the patient is asleep, when he is awake and patient can gather the information. How to learn from it? First of all, accept it went wrong. Try to analyze where it went wrong. Try not to blame others for the mistake you have done. Discuss with colleague, morbidity and mortality meetings or M&Ms. A friendly investigation by the department for root cause analysis. In the end, I would like to talk about what rights patients have having had done a wrong-sided block on them. Once you are informed by your clinician, be assured as no harm had happened to you. You can accept his apologies as no clinician would want to harm his patients. You can also make a complaint to your clinician or to the staff or to the hospital for more clarification or further investigation. Can you ask for monetary compensation? Yes, of course you can ask. You can ask the hospital for monetary compensation. Since no serious harm has happened to you, it is unlikely they will agree for monetary compensation. Please drop in your suggestions for further education. Thank you.